Hey everyone, this is Holly Knutson. I'm a functional health practitioner from Utah, and today I'd like to continue my cancer series and talk about ovarian cancer risk factors and symptoms. Ovarian cancer is referred to as the silent killer, and with good reason. The symptoms associated with the disease can be somewhat vague in nature, that by the time the cancer is diagnosed, it has progressed to the point that treatment is no longer effective. And here's a sobering statistic. Only a small percentage, roughly 15 to 20% of ovarian cancers are found in the early stages when treatment response would be favorable. Sadly, early stage cancers rarely manifest with any symptoms. When symptoms do present, they're often mistaken for conditions that are benign. The cancer by that point has often already spread to regions within the abdomen and pelvis. Symptoms are important because they can provide possible clues into what's going on internally. Being aware of the warning signs and getting an early diagnosis is key to survival. Unfortunately, symptoms many times are not taken seriously until the cancer has become aggressive. What is ovarian cancer? Cancer occurs from cellular mutations in DNA. These mutations send signals to the cell to rapidly grow and multiply. Tumors form as a result of this abnormal growth, which causes cells to proliferate and invade surrounding tissues. Ovarian cancer is the result of DNA mutations within the ovaries, which are part of the female reproductive system. Each ovary is approximately the size of an almond. Their function is to produce eggs, along with progesterone and estrogen, two female hormones. The recent death of Canadian plus-size model Ashley Luther, better known as Ellie Mayday, has garnered attention for ovarian cancer. Ellie Mayday was a body positivity advocate who openly shared her ovarian cancer journey. Tragically, she died March 1st, 2019, and she was only 30 years old. Luther was diagnosed with stage 3 ovarian cancer in 2013, 3 years after she started experiencing symptoms, such as bloating and lower back pain. Sadly, her symptoms were dismissed by her healthcare providers. If you experience any of the symptoms that I'm going to talk about to any degree, get them checked out immediately. It could be a matter of life and death. There are 3 types of ovarian cancer. The type is determined by the type of cell from where it originates. The first one is epithelial tumors. This is the most common type of ovarian cancer, with up to 90% of cancers beginning in the epithelial tissue that surrounds the ovaries. Number 2 is stromal tumors. These are tumors that originate in the cells that produce hormones and are typically diagnosed earlier than other types of ovarian tumors. Stromal tumors account for only 7% of ovarian cancers. And the third type of ovarian cancer is germ cell tumors. This is a form of cancer that tends to occur in teenagers and young women. It develops in the germ cells that produce eggs. It's unknown what causes ovarian cancer, but certain risk factors will increase the odds of someone developing the disease. However, many women with ovarian cancer are considered low risk and they still get it. Conversely, having several risk factors does not mean that you're definitely going to get ovarian cancer. Most cases occur in women over 50. Risk factors include age. The older you are, the higher your risk. Having genetic mutations such as the BRCA1 or BRCA2 genes, taking estrogen without progesterone for prolonged periods of time, being diagnosed with endometriosis, having an Eastern European background, difficulty conceiving or never experiencing a pregnancy or birth, having 2 close family members who have had the disease, early menstruation before the age of 12, and late menopause after the age of 52. Also, if you've ever had an IUD. Here are some symptoms of ovarian cancer. Now, the symptoms are nonspecific and could easily correlate to other conditions. This is why ovarian cancer is so deadly. By the time the symptoms are taken seriously and the disease diagnosed, the cancer is already advanced and aggressive. Ovarian cancer is a relentless disease. Half of all patients who receive treatment with chemotherapy and have gone into remission will have a recurrence of the disease within 3 years. Back and abdominal pain, painful urination and frequency, constipation and diarrhea, bloating and a feeling of fullness, indigestion and heartburn, fatigue, loss of appetite, worsening muscle weakness, skin rashes, vaginal bleeding, painful or missed periods, trouble breathing, and unexplained weight loss. Why do these symptoms occur? It's not unusual to occasionally experience any of the symptoms that I just mentioned. It's when they become chronic and are not alleviated by normal interventions, such as changes in diet, rest, and stress reduction, that alarm bells should go off. As ovarian tumors grow, they press on the bowel, bladder, uterus, stomach, and lungs, which creates the symptoms, including alternating diarrhea and constipation, incontinence, heartburn, cramping, and difficulty breathing. Cancer also impacts metabolism, which can cause changes in appetite. Abdominal pain is a common symptom of ovarian cancer, and any pain that lasts longer than a couple of weeks that isn't due to menstruation or a virus should be cause for concern. This holds true for back pain that apparently can feel similar to labor pains. Chronic bloating is another symptom, with bloating being significant enough that a woman's clothes may be really tight without making changes in eating or exercise habits. Alternatively, unexplained weight loss that happens quickly could signal that something isn't right. Abnormal fatigue and exhaustion is another potential warning sign, particularly in the broader context of other symptoms. In summary, although ovarian cancer is quite rare, it's the most common type of cancer in women and the 8th most common type of cancer in the United States. It's the 5th leading cause of death, but the good news is that rates are declining. Ovarian cancer is diagnosed most frequently in Caucasian women. Do you know someone that has had ovarian cancer? Please share your experiences in the comments below this video. Thanks so much for watching.